this press briefing is to announce a new facility which is a cutting edge technology in the treatment of varicose veins, which has been started in Goa Medical College. And with me I have Dr. Pawan Kumar, who is an expert interventional radiologist. So the incidence of varicose veins in state of Goa is almost 20 to 25%. I suppose you know what is varicose veins. It is a condition where the veins of the leg become very tortuous, they become bluish in color and they become very big, and they do not function normally. The normal function of the vein is to return blood back to the heart, and this small thing which is seen causes a lot of dysfunction in the lower limbs, and this leads to symptoms like itching, it leads to symptoms like discoloration of the leg, and also ulcers. The varicose ulcers are the wounds which do not heal. The earlier treatment for this means, what all these days what we were following is to ligate the incompetent valve. So there is something called as a valve ligation surgery. So this is a surgical treatment where we used to ligate the valve of the big vein and also ligate the perforators. And there was one surgery which is still followed called as a stripping of the vein. Now these are all big surgeries, they are all invasive procedures, and hence many of time these patients get recurrence, and they want they feel that these surgeries are little bit painful. So now what we have done is we have introduced a machine which is called as endovenous laser treatment machine. Now this machine you can use through a small hole of 2 millimeters in the vein, and you put a fiber of a laser inside the vein, and you send the laser waves, and you coagulate this vein, you contract this vein and reduce the size of the vein, and this becomes your treatment, and the recurrence rate after this treatment is very low. That means only 2% people can get it again and might require a second time laser. But the advantages here is there is no big surgery, there is no cut that is given, and the patient can resume the work next day. So we wanted to announce this state of art treatment varicose vein because there are many patients in state of Goa who are waiting for this treatment, and through your media we wanted to announce it. Our Honorable Health Minister, I informed him, he said that this is really a great thing that Goa Medical College is doing. He has congratulated the institute, and he said that he cannot be a part of this basically because of code of conduct. So I would now request Dr. Pawan Kumar as an expert to speak on the subject as per se. So Dr. Pawan. I also have with me Dr. Dhaval Patarpekar, who is our microbiologist. He has come. If you have any question on COVID, so he will answer that.
So basically, what happened varicose vein, the person who work like standing, like chef, or person who are like driver or a teacher, when they stand for long hours, like 8 hours, 10 hours, 12 hours, then the blood get collected in the vein. So the pressure in the leg, in the vein, it increase too much. Then this blood column will form, and after that, after certain time, that the wall become dysfunctional. So will become more and more dilated. So blood is not going returning to the heart; it is cut in the vein in the leg. So it will cause the swelling of the vein. Then after that, it will cause the discoloration of skin, and after in the late stage, the ulcer can become, which is called as venous ulcer.
These ulcers do not heal on their own, and it is really difficult to treat these ulcers. So once you now do endovenous laser therapy, these ulcers will heal very fast, and then patients the blood which gets collected in this venous system, it becomes kind of a stasis and does not go into circulation, will go back into circulation. So there are many advantages of this, and I feel that government of Goa has given us this machine. The Minister of Health said that you go ahead, start this unit, and we started this unit just 3-4 days back,
Yes.
and we have already treated about 24 patients, and they are happy about it.
तर असे कितले पेशंट तुमच्याकडे ॲलोपॅथी येयला सो
This incidence is almost 20 to 25%. म्हणजे आमच्या ओपीडीन दिसाक काय ना म्हटल्यार म्हज्याच ओपीडीन ऑर्थोपेडिक ओपीडीची काय ना म्हटल्यार म्हाका 5-6 तरी पेशंट येता आउट ऑफ 35-40. माय ओन ओपीडी actually varicose veins is treated in general surgery OPD, but sometimes they feel that शीर दुखता म्हटल्यार ऑर्थोपेडिकाक दाखोवपाची. So it is so high incidence, and it is not only the incidence that bothers us. What bothers, till date there was no proper kind of a solution to this. Means we were doing multiple procedures and the recurrence rate used to be high, and then again patient satisfaction was not much. Thirdly, patient used to be away from the job. Now here, if you do a endovascular laser, patient can join the duties immediately next day.
तर यात एंडोमस्क्युलर केले दिसाक कितले करपाक शकता
How many?
पर डे
How many you can do per day?
Per day, like last Saturday we did 4 cases in a day. So things that when we have other disease condition, this varicose vein is like not a life threatening, but it increases the morbidity. So in that way,
In that machine, suppose we have no other
then we can do around 10 cases in a day.
we can average do 10 patients. But what happens? We have a separate now cath lab for only peripheral vascular disease. This is the only medical college which has a separate cath lab for other vascular diseases. So there are some life-threatening diseases called as aneurysms. So if we do that, that cath lab remains busy. That's why he is saying that he has done 4 because other cases were more emergency. But if there are no emergencies hard pressing on that day, he can easily do 10 patients per day.
This machine is specially for this only.
Yeah, this machine is only for veins.
So machine cost.
So machine 20 lakh with fiber. The machine cost is 10 plus we need laser fiber. So we bought around 50 fibers.
Yeah.
एका पेशंटला कितलो कॉस्ट करता
Yeah, treatment is
ट्रीटमेंट
free.
फ्री बट
बाहेर
कितलो
तो
कॉस्ट
Around 70,000 to 1 lakh. Depend on hospital. Minimum is 70,000.
Outside, I think the patients are paying almost more than a lakh. But here we are doing it free. But it is going to cost government about 70,000 because one fiber is used per case. The fiber is costing
Fiber is
25,000.
What are the symptoms ki like?
Symptoms varicose vein, I think most of you must be knowing. शिरे मोठे जाता पळय, ब्लूइश जाता आनी फाटल्यान येदे दिश्टी पडटा. येदे व्हडले दिश्टी पडटा. चडशे बायलांक जाता ड्युरिंग प्रेग्नन्सी. Then if you are obese, if you are fat, obesity is one reason. Then as he told you, standing profession like musicians, guitarists, हे सगळे असतात पळय, तांकां जाता. टीचर्सांक जाता. आमचे सर्जन्सांकूय जाता. One who does long, like we do spine surgeries for more than 6 hours. So it is quite a common condition. That is why this thing was needed. And we made a study. We saw people were going outside of the state because we had this machine was not there. But we procured this machine, and the machine plus the disposables. As of now, we have spent 20 lakhs.
Are there any side effects for the treatment?
No, it's very safe. Safe, no?
Yes, sir, very safe.
So that's why expert is with me. He's saying it is very safe. And laser therapy in no way is, see, the laser therapy used in retinal detachment in the eye. I mean, it is so safe. There is no other therapy safer than laser therapy in medical treatment.
So there is a specific age group where varicose veins are seen.
Mostly we see varicose veins after middle age. Youngsters we have hardly seen. We had seen one musician who had very big veins, very young, below 30. But mostly it is after 35-40. No?
Long standing work hour like 10-15 years लगातार. If it patient like suppose teacher, 10-15 year teacher profession and studying for 10 hours per day. Then
सो आता पेशंट किंवा असा ह्या ऑपरेशना खातीर ट्रिटमेंटा खातीर खंयचे पेशंट
आता आम्ही फॅसिलिटी चालू केल्या न्ही.
पूण तेच्या खातीर
नाव पेशंट्स आर वेटिंग मीन्स पेशंट कम टू ओपीडी दे गेट ट्रीटमेंट. none of them are sent
Tube.
back. So we have different therapies like mechanical compression, stockinets, all that is going on. Now out of this patient, we will be selecting for laser therapy. So that the worst case is first. Those who have grade 1, there are grades of varicose veins. So those patients who are really suffering, we will prepare a list. Now we will issue a circular to all departments where these patients are landing, like ortho, then general surgery. And now these patients will go back to the intervention radiology OPD. And Dr. Pawan will see them. And he will decide which one gets a priority. So we will definitely have a big list now.
So how
As
much
of
time-
now, we have not got a list.
How much time it takes for this laser treatment?
One patient, how much?
1 hour.
1 hour.
1 hour.
How many patients are detected prior to getting a machine?
No, detected means we have big number of patients. See, they keep coming, no, in OPD. What we are trying to tell you is that this is really a great technology. It's endovascular laser therapy. So this was not there initially. That is why we have started this unit.
Now these 24 patients you have treated, no? Any peculiar thing that you have observed about them? Any age group or men or women?
It is more, that age is only like above 40, around 40. The 54 is
After
around
middle age they get.
But awareness especially for teachers, for studying, or this
There are preventive exercises and all. We give them prevention part also for teachers and those who come in early age. We tell them use stockinets, use elevation, But then compliance is very poor. Now see, every day we wear socks. We get so upset to wear a socks. So some people wear shoes without socks. So if I tell you wear a socks from foot to the thigh, groin, nobody will wear every day. So we saw that compliance is poor. We are doing all that education wise.
But the teachers are
But we tell them you can use a stockinet if you are having a grade 1 varicose, you can use the stockinet. But then many a time they don't use and they get into very high grades, and then big veins are visible. So any stage we can use this technology.
police are traffic police.
असू शकता. And it has little bit of hereditary predilection, means some people hereditarily have a weaker veins. They get varicose veins early.
How many doctors are trained for operating a machine?
This, as of now, we have a team of doctors along with Pawan is leading the team, Dr. Pawan, and I think 2 more doctors are also trained. We will train slowly since we have just started it. The training part will happen.
So treat करपाची कितली इम्पॉर्टंट आसा जे लोक ट्रीट करपाक येना तांकां सायड इफेक्ट आसा
ना आता कशें आसा पळय तुमकां हांवें सांगलें की कन्वेन्शनल ट्रिटमेंट आसा तातूंत खूब इश्यूज आसा म्हणून हे लेजर थेरपी चालू केलें. People who are now suffering, they get ulcers and all, they can come now. We will treat them. We will give them complete cure with this. Understood? No? So,
अल्सर कित्याक चान्स
huh?
करोना ट्रीट जाता
Ulcers जाताच तांकां. Somewhere in the life they get, it's called as non-healing venous ulcer. Healूच जायना तो. So ताका ते endovascular laser therapy is a must.
Screening programs.
आणि करपाची गरज नासना because lot of patients come to OPD. Lot of patients come and varicose veins actually I am surprised that you are not aware because तुमच्याच घरात कोणाक तरी आसतलें पळया तुमी. It is household problem. म्हणून we thought it is more important to create awareness through media.
Other than varicose vein, any other disease can be treated by the machine?
This machine is only for varicose because the laser fiber that we use only is for a venous reason. Understood me? There are many laser therapies for other vascular issues.
And sir, KP1 आणि KP2 व्हायरस असा आपण कोविड व्हायरस त्याचा सेम किती GMC पेशंट्स and all.
KP1, KP2 माझ्या बरोबर मायक्रोबायोलॉजिस्ट आसा पण आम्ही he will tell his experience, Dr. Dhaval. So he says it is not very significant because we have not detected, but some samples in Goa were found to be positive. So let him speak up.
Yeah, there were around 30 samples which were sequenced at Azilo Hospital under the DHS, that is the North Goa District Hospital. 30 samples, out of which 1 sample was found to be KP1 positive and 11 samples were to be found of KP2 positive. Now this KP1 sample is prevalent all over India, the recent outbreak. But the virulence of this KP1 is low, the transmissibility is similar because it's an Omicron variant. So the transmissibility is same as the Omicron type. But the virulence is lower than the predecessor, that is the Delta variant. It's much more less as compared to the Omicron variant, which was in the third phase of the COVID pandemic. So we are equipped. Goa Medical College is equipped with doing gene sequencing. We have a state-of-the-art Illumina machine, which was being sponsored by UNICEF for us. So it was a free of cost machine which was given to us. We have a state-of-art VRDN lab also, which is there in which we have already run one run of gene sequencing, which was validated by National Institute of Virology, Pune. Now, as cases come, this machine has a capacity of around 96 samples. So, whenever COVID outbreak is there, if it is positive and if the city value of that particular COVID samples are less than 25, then we can directly put it for sequencing. So right now we are getting in Goa Medical College out of say 8 to 9 samples, around 1 to 2 samples positive. But they are not of this KP1 or KP2. But these samples were isolated from Azilo. There one sample and 11 samples from Azilo it was isolated.
But this is a what period?
It is of 1.5 month back period because and these samples were there were symptoms. There were no specific symptoms as such of COVID. They were admitted in the hospital. Like normally thandi jata lokank cough asta. So when they are admitted pre-operative, they were.
It is an
incidental finding.
not focused finding.
Focused finding. Then just for 1.5 months. So period also is a very big period.
Very important point
Not
here.
they were COVID patients.
Yeah, they were
No,
not
common
COVID.
cold
Yeah.
and they were tested for a COVID.
Yeah, routinely it is done.
So
Patients
what
are
happens
admitted.
here, the most important message that we want to tell you is that this is a mutation of Omicron and it is not virulent, it is not life-threatening. So it is as good as how Omicron came and went. So we expect the same behavior here. It is not like Delta. Understood me? And not an alarming situation also because the incidence is very low.
But we are testing these samples after.
We have the best sequencing facility in GMC now.
No, that is okay. But if we collect these samples for how many samples are collected, and then we are testing.
Yeah, samples usually for an nanopore which is there in Asilo, you can test around 24 samples. But for GMC, there should be 96 samples. Then the cost effectiveness is very important. If there are less number of samples, 48 or 24, then the kit is not cost effective. So what we do here is that if there are some samples, we send it to Asilo. So they sequence it there. So that is how
Less samples we send it to
Asilo.
If there are more than 50 and all, then we take it here.
yeah.
So that becomes cost effective for government also, no? So don't have to spend much on kit.
काय सुविधा सर जो आयतारच्यो एकदम मेळना ज्यो सुविधा आयतारच्यो जेन्ना सुटी आसता तेन्ना अवेलेबल जाता फॉर एग्जांपल काय केसीस अश्यो आमकां आयकपाक मेळ्ळ्यो की सोनोग्राफी आयकले तांकां आयतारच्यो नासता टेक्निशियन
शक्यत ना.
आमचे असं एक केस ताका सोमारा रिफर केलं then he went to Maharashtra.
See, I will tell you, there is a casualty department. Attached to it, there is 24/7 CT scanner. Attached to it is a X-ray facility and ultrasound room. One radiologist is on call round the clock. And I don't know why this has happened, but one SR and 3 JR on duty. Now, what communication has happened between your patient and the authorities of hospital? But 24/7, and I keep visiting. I do surprise visits because in a day, in a casualty emergency, we get almost more than 300 patients. This was not the scenario earlier. So today we get a lot of emergencies, and our center, even at 2 o'clock in the night, it is open. In whole of Goa, the best casualty facilities in medical college. But since you have made a point, I will just go and check it again. Sunday. No, Sunday also it is open. There is no Sunday for a doctor here. Because we have residents on call around the clock. Like this Sunday one resident will do, next Sunday other resident will do. So there is a call duty and there is a roster. You can see there is a name of the doctor put on duty. Understood me? So if it has happened, we will check it and you'll see that things don't happen like that. Okay?